So I think we'll go ahead and get started. For those of you who don't know me, I'm Dean Ellen McKenzie, and I'm just so glad to have everybody here in the room, as well as on the Zoom. Before I do begin today, I would like to just take a minute and acknowledge that the Bloomberg School has lost a very dear colleague and friend, David Levine, who made tremendous contributions to both public health and medicine, passed away yesterday at the age of 86. David was a pioneering thinker who was dedicated to addressing the social inequities that drive health disparities. I'd like us to just take a very brief moment and a brief moment of silence to honor his memory. Thank you, and thank you all for being here. So this lecture series gives us a wonderful opportunity to learn from our colleagues, our newly appointed professors, as well as our newly appointed and promoted senior scientists. Newly appointed and promoted professors and senior scientists. We get a chance to hear firsthand how our colleagues are really changing lives through their research, practice, and teaching of public health. Now, of course, we all acknowledge with the presidential election now decided, we are faced with the challenges of pursuing our public health goals under a new administration. As we look to the future, I know many of us are thinking about the health and well-being of our young people, our children, and our adolescents. In this particular moment, I'm grateful that we were able to come together and to listen and learn about the great promise of the work that we do here at the School of Public Health, and specifically today around school-based mental health. In fact, I'd like to start with a quick bit of history that I think many of you in this room know all too well. But just about over 40 years ago, a public health psychiatrist named Shep Kellum, who many of you remember, who know, he joined the Bloomberg School and set out to work on a compelling research question. How can we address aggressive behavior in young children, and what would be the long-term impacts? Shep and his team saw promise in the good behavior game, a simple intervention to help curb disruptions in the classroom. The game operates through group-based rewards so that the success of each team depends on the ability of each individual child to manage their own behavior. And as I'm sure you all know, this long-term research has shown remarkable results. Children who played the game were less likely to attempt suicide later in their lives, less likely to have a drug use disorder, and more likely to graduate from high school. This was landmark research. And in the decades that followed, the Bloomberg School has continued to grow and evolve this work, specifically around school-based interventions that promote better mental health. And today, we have the great fortune and opportunity to hear from one of our leading researchers and thinkers in this promising space, Dr. Elise Pas. Elise is a research professor in our Department of Mental Health and has dedicated her career to advancing programs that make a difference in our schools and in the lives of young people. Her work spans research, policy, and practice, and is focused on bringing evidence-based preventive mental health interventions into our K-12 schools. We all know how urgent this issue is. Our nation's youth are experiencing a wide-ranging mental health crisis. Anxiety, depression, and suicidal behaviors are on the rise. Addiction and violence remain persistent threats. And while we know public health can offer powerful solutions, introducing new programs into a school system is at best challenging. But Elise has always been up for the challenge. With a PhD in school psychology, a deep expertise in public health, and a no-nonsense approach, she is a triple threat when it comes to making progress in a very tough field. There was once a limited evidence base on school-based behavioral and social emotional programming, but Elise has helped to address this gap, making major contributions to trials for both universal approaches as well as some targeted interventions. For instance, Elise helped lead a statewide study of the effects of scaling up school-wide framework known as positive behavioral interventions and supports. And this research gave us a better understanding of the impacts of the program on suspension rates, as well as reading and math proficiency levels. And for that work, Elise won the Paper of the Year award from the Journal of School Psychology. But in addition to growing our knowledge base, Elise is deeply committed to ensuring that our most promising findings can be translated into practice and good policy. She has developed and tested coaching models for teachers, engaged with state policy evaluations, provided professional development to practitioners, and so much more. Through her efforts, Elise is helping bring powerful change into our schools and making a very real impact on our young people. Let me just give you a couple of examples. She is empowering teachers to better detect and prevent bullying. She is working to reduce disparities in the support and services for adolescents with autism. She is advancing a highly practical program that trains high school teachers and students to recognize when a fellow student is in crisis. As we know from the good behavior game, these types of interventions can really make a difference long term. When we invest in the mental health of our young people, we reap incredible dividends. Elise is giving students tools that will serve them throughout their lives. She is building their resilience and putting them on a positive path as they do grow. And finally, her contributions extend far beyond her research. Elise is known for showing tremendous care for those around her, nurturing both the well-being and the careers of the people she works with. Very nice. We see this in her past service or her work as a faculty member in the department in the school, but also in her past service on the faculty senate, as well as her current role on the Johns Hopkins University Council. And I've gotten the chance to work more closely with Elise in her role on that university council, and it's been great. She is also a great source of support and guidance to other faculty in her department. We are so grateful for the many roles she does play, both in the department and the school, and for the way she brings her compassion and her commitment to all of these activities. Professor Pas, it's a delight to have you here as the Dean's Lecturer. Not yet. Now, I welcome you to the podium. Thank you so much. That was really touching.
Wow. I was extraordinarily humbled just to be asked to be here today, and to start with something like that is just incredible. So thank you so much, Ellen, for that amazing start. The feature of my talk today is really about partnership and how we work in partnership to achieve mental health goals, public mental health goals. And so I'm just going to start with a little room, if I can figure out how to use this. Three screens every time. I'm going to start a little bit talking about what Ellen actually already did an amazing job of introducing, which is the youth mental health crisis in our society, and this is a public health concern and how it intersects with schools specifically. I'm going to take you a little bit on a history tour. I've seen many others have taken this opportunity to really reflect on their careers, and this was an amazing opportunity for me to do the same. And so I'm going to take a little bit of a history of an emerging education science, what that meant federally and what that's meant for our schools, and then for me, where my own history has coincided so much with that history. The bulk of what I'm going to do is give you a snapshot of different projects that I engage in, many of which Ellen has already mentioned, really through this lens of how partnership has been the main central reason we can achieve the promotion of public mental health in these trials and in other partnership activities. And then I'll just end with a little bit of a reflection about what still needs to be done, and certainly Ellen has alluded to that as well. So let's just talk very briefly about youth mental health. Ellen has already talked about these statistics, so I'm going to go pretty quickly through them. But we know that mental health conditions, and that's at the level of a condition, a diagnosable disorder, is quite prevalent among our youth, starting at a young age. But certainly we see emergence in school age, ages 6 to 11, and we think about adolescence. You can see those bars increasing, particularly for anxiety and depression as kids are moving into that adolescent stage. But often what happens because of how this coincides with school age is schools are the first place to recognize when there's symptoms. This is the first time for some children that they have to be in a really structured environment as well. There's different demands being placed on them. And so that serves as an access point. And we know that schools actually are one of, if not the largest sector of mental health access for our youth. We also, as Ellen mentioned already, have seen an extraordinary increase in youth suicide over the last 10 years. And so there's no doubt that there's quite a need. In schools, we have what we call educational disability. So you could have a mental health condition, but if it isn't impacting your education, that wouldn't necessarily reach the point of being an educational disability, and therefore you wouldn't have additional supports put in place. There are 13 classifications for students who have a disability that is also educational in nature. And I've highlighted 5 here that are central to the work that I and others in the school are thinking about. And those are our developmental and mental health disorders. I'll note the most prevalent of all of the disabilities is specific learning disability, which is very academic in nature. However, at least a third of kids with a specific learning disability also have comorbid mental health conditions, usually ADHD, attention deficit hyperactivity disorder, anxiety, or depression. And so there's no denying that this is something very much in the space of public schools. They're there to create an environment for free and appropriate education for all students and are being asked to build those supports for kids who have a disability. So in 2021, the U.S. Surgeon General released a report raising concerns about what was considered to be unprecedented and alarming increases in the prevalence of certain mental health conditions. Notably, they cite some findings like the persistent feelings of sadness and hopelessness that our youth and adolescents specifically are reporting. And I'll note here that that type of surveillance work is happening in our schools. So that's another part of the story around schools and how central they are to mental health. Schools, as you can see in the community ring, are identified as an important context, and they specifically flag this sense of community, relationships, and mental health access as being key protective factors that schools can be providing for youth, and to both support them if they're having mental health needs, and then also to protect them. Ellen already alluded to it today, this feeling of being in community, being together when things are hard, that is something that we know is so protective for children. In fact, having just one caring adult in the life of a child can make a big impact on their mental health. And often that one caring adult could be in a school. We would hope that at least one adult in the school would be that caring adult for our children. So this whole idea around these factors really builds upon what we know to be Bronfenbrenner's social ecological model that says that we are all developing in multiple contexts, and there's multi-systemic ways in which we develop either for the positive or not. And so thinking really from a more strengths-based and protective side, we know there's so much that schools can be doing, and there is so much that they really are trying to do. In the report, they also identify specific areas that I summarized in fewer bullet points here that I think are really important to note, as they hopefully will become apparent to you that they are aligned to the work that I have been doing and where I think we need to be going as a field. Schools that should be providing positive and affirming environments, engaging in evidence-based social, emotional, behavioral programs to promote healthy development, empowering and enabling educators to identify shifts and changes in mental and physical health and seeking action and supports when they are noticing that, providing a continuum of supports to meet mental health needs and prioritizing those who need them, so really thinking about our public health model, expanding the mental health workforce and supporting workforces' mental health. So I kind of want to now take a step back. I want to start about 24 years ago when we were starting to see an emergence of shifts in our federal education policy and an emerging education science. So in 2001, you might recall, there was a bill called the No Child Left Behind bill. This was a reauthorization of an existing bill from 1965 that had created a role for federal government in education and had also started to provide funding for Title I, which means schools that were providing supports to kids in higher density of poverty would get additional funds. And this emergence of No Child Left Behind, the name kind of signifies what it was, is this idea that we aren't bringing everybody to the point where we should in education, and we need to address that. And it really emerged from a concern around the U.S. losing its international competitiveness, and also from growing gaps. So if we go back a little bit further even, and we think about desegregation of schools, there was the 1954 Brown versus Board of Ed decision that worked to desegregate schools. It took a good decade or so for that to start to happen. And you started to see a real change in the trajectories of Black youth in specifically in terms of graduation and achievement. And that started to really stagnate in the 90s. And then there was this concern in 2001 of we are no longer competitive, and we're not kind of reaching our goals, and that there wasn't enough accountability for schools to really do that, to really meet the needs of all of the students and be able to graduate educated and productive citizens. And so this bipartisan bill came out and then established in 2002 the Education Sciences Reform Act. They said we have to have high quality instruction, and then realized that there wasn't actually a good science, that we didn't have a good sense, to Ellen's earlier point, of what really worked in schools. And this started the research arm of the U.S. Department of Education, the Institute of Education Sciences. So in public health, we have NIH, and this didn't exist for education. There wasn't an infrastructure to even think about how we research and think about what's going to really work for who. So that was a pretty monumental shift. Around the same time, we started to see in education practice this emergence of a public health framework. This also coincided with some rises, as we're seeing now in youth mental health. There was a rise in behavior disorders of kids being identified in schools for needing support through special education. And there wasn't a good literature base to say, how do you really support these kids and make them successful? And so there was some interest in starting to study that, and the University of Oregon engaged in that. And they identified specific targeted interventions and indicated interventions that could support, but really realized we actually need universal preventive work in schools, and started to build out a framework for schools. And then there was funding that came through the Individuals with Disabilities Act to actually provide technical assistance around the country to schools to do this. So this would become PBIS. And as that evolved further, it really started to bring in what I love most about the model, the implementation science, really understanding how do you get the right supports in place to get things implemented in real world settings, because it is very challenging to get things implemented in schools. At the same time, I was starting a graduate program at the University of Maryland. I went into school psychology because of work I had done with students with autism. I worked in a school for 2 to 11-year-olds. We didn't even say that they had autism back then, but pervasive developmental disabilities. And I also was doing some work in summers for an extended school year programming that some kids do get through their individualized education program. And I was really interested in helping kids and helping special education. So that's what brought me into school psychology. And I had the unbelievably serendipitous luck that at the same time I had started there, IES, this brand new research infrastructure, started a multi-site trial that they wanted to look at social and emotional and behavioral development specifically. And that was the first time that had happened. I mean, it was in its infancy still. And Dr. Gary Gottfredson, who I believe is here today on Zoom, was a recipient of one of these 7 sites to study Second Step in Maryland. And he was looking for a research assistant, and I was looking for a research assistantship, and he hired me. And after that, he told me he hired me because he knew that I could talk to the schools. And that was a first lesson of many from Gary in humility and knowing what your limitations might be and building a team around you to do it well. But he sold himself short because there was so much that I actually learned from that work with Gary. Number one, the impact of school-initiated research. This was actually initiated by the district. They were interested in implementing Second Step. And that, I didn't realize at the time, but going forward 2 decades, had a really big impact on the way that we could partner with them for this research. Gary taught me about being a good research partner and giving back. He says he hired me to talk to the schools, but he taught me things like, we're going to meet with the district regularly, we're going to go on site, we're going to be with them, we're going to give them back data. They're giving us all this data, we have to have a way to give it back to them so that they can use this for their decision making. And then he said, and we have to really think about celebrating and appreciating them. And we have to have a breakfast of some sort. And I think it should be secretaries that get invited because they are the access point to everything. They have the principal's schedule, they can tell you when the data collection can happen, they can help you with those consent forms. We have to celebrate those secretaries, and we did. And that is a seed that has grown, I hope, in my partnerships with all those that I work with in the field today. The study also taught me about the complexity of implementation fidelity and the need for support systems. So our intervention schools had built teams, character development planning teams, around the implementation of Second Step because they knew that without that, they couldn't get it implemented the way that they wanted to. They'd be competing with too many other things. And the other thing that really stands out to me was I reflected 20 years later about all of this is how schools think about outcomes and evidence. We would sit in meetings often talking about data, talking about the process, and we would be working through what they were seeing versus maybe what data would show. And one of the things that emerged in that study is we had some ceiling effects in our surveys, meaning that the kids looked pretty good when we asked teachers and we asked kids. And so that's hard to show an improvement when you already are kind of on the high end. And at the end of the study, Gary said, we got to think differently about this outcome. And we designed an observational tool. Gosh, I think about, would the IRB really go for this now? And he came up with the whole idea. Let's frustrate the kids in a team activity and then observe how they respond in real time. It's a game and it's a team, but let's watch what really happens. And lo and behold, that was the one measure we saw impacts of Second Step on. So all of this time being spent in this work with the social and character development initiative and learning from Gary, I was also learning in school other things, one of which was consultation and really focusing on staged problem-solving approaches, communication skills to empower change in behavior, and really learning that I had the tools to improve student ecologies and not just work with individual students. And that was really groundbreaking. Hopefully by now in the School of Public Health, you're all thinking like, she should be in public health. So that's really what happened. I really shifted my focus from more of what drove me into the field to begin with to really wanting to improve adult practices, to wanting to think about systemic approaches, to thinking about implementation fidelity in a much more nuanced way. We were the first study to look at social, emotional, and behavioral programming, and I knew we had a big gap to fill, so I wanted to give into that. I wanted to understand what works. And I really I started to want to promote outcomes for populations. So now I'm going to move through the work that I've been doing through this partnership lens. So the first step I took was a formal introduction to public health. I came here in a training grant, work with Dr. Philip Leaf and Catherine Bradshaw, and I knew much about what was happening here, but I didn't actually even have a full understanding of all of the things that they were doing and thinking about, just like Gary was. And that was a real blessing when I got here. And those relationships are still a real blessing. As I thought about the things that I learned from Gary and from the Social and Character Development Initiative, I thought about what are the themes for partnering. So there are 4 things that I think really come through in my own thinking about how to partner to promote public mental health. So one is that need for an impact of research that's based in practice, that allows for joint identification of problems and solutions and intersects with policy. We have to really be doing the work of real people in real world settings and answering the questions they have. Building those deep partnerships through communication, through giving back, through shared voice is another theme that really started with Gary and I kind of tweaked it a bit. Third is the complexity of implementation fidelity and that need for supportive systems. I didn't mention the other thing I learned with that trial was how many things schools are doing that are all related to the same goal. There were so many different programs that were happening in those schools, in our intervention schools and our control schools that were focused on social and emotional and behavioral development. The good news is when we actually measured the difference, there was more exposure to structured time with students focused on explicit skill teaching with Second Step. And then fourth is meaningful measurement of fidelity and outcomes. It has to have something that people care about in the real world. I shouldn't have to say that out loud, but that is really a big part of listening and learning what matters to people. So when I came to Hopkins, I had already been in Maryland. I knew about PBIS. I even tried and failed at a master's degree on something about PBIS in its early stages. And it took me a minute, but I got here and I remembered I had been at a training that Phil Leaf had been at before on PBIS. And what I didn't realize at the time was the robust infrastructure in the state of Maryland that Catherine and Phil, through Johns Hopkins, were partnering with Shepherd Pratt, that was a technical assistance provider to the schools, the Maryland State Department of Education, and all of the school districts in Maryland. And that built such an incredible infrastructure for learning about all of the things that I realized I wanted to be thinking about. So I have a couple of titles of articles. The first thing we were able to do in that is just talk about what partnership looks like. So that first article, Statewide Partnership to Promote Safe and Supportive Schools, we could just put out there, this is what multi-agency partnership in education research looks like. This is how you achieve it. These are the challenges. These are the goals. The second is we could actually just look at what's happening in the field. Wasn't a randomized trial, but when I got to Hopkins, we probably had about 500 or so schools in the state of Maryland out of a total of about 1,400 at any given point that had been trained in PBIS. So we could look at how do the implementation fidelity measures that we're collecting as part of this robust infrastructure relate to outcomes. And then for those of us who get really excited about research methodology, we could even look at this natural experiment and do a quasi-experiment and see how does that, this is the paper that Ellen talked about in the Journal of School Psychology, is it really impacting outcomes? And the outcomes that people care about, suspensions, truancy, academic achievement in math and reading. And this came from the fact that there was this bi-directional discussion with all of these practitioners who were thinking about this. There were relationships being made. There was the ability for us as researchers to hear what mattered on the ground, to hear anecdotally about what mattered to them. The paper about the implementation measure, for example, is that there were multiple measures that had been used in PBIS dissemination across the country, and that paper found that only one of them was associated with outcomes. So that became the measure that stayed around, and eventually other measures faded out. We have a second measure now, here we are in 2024, that has replaced an old measure, and we're now looking at that one to see how that associates with outcomes, because those are the questions that matter to the practitioners, and those are what actually shapes their own database decision-making, is they have to have good data tools, they have to trust them, and they have to know that they're actually valid measures, that if I actually achieve implementation fidelity, I might get the outcomes I'm looking for. The translation piece is a natural part of this partnership in Maryland. So there's a structure for leadership that is with those high-level individuals. And then, of course, there's the schools and the classrooms that are actually implementing this in real time. But being able to have that kind of direct contact gave a perfect venue and infrastructure for translating research findings that were either immediately relevant to PBIS Maryland or related to other things that we knew they might care about, like coaching teachers or aggression prevention. And so I worked closely with the authors and junior faculty and postdocs to start to think about how we just develop these, I call them 2-page one-pagers, the front back one-pager, back when we used to print things, that would summarize different research studies. And even though I wasn't the lead on all of the briefs and I wasn't the lead on all of the papers, I wasn't even an author on every single one, but many of them, I was the one that got to present many of them in more recent years. Another thing that this presented the opportunity for was regular interaction with training activities. You probably have noticed this already. I love this. I'm an extrovert. This fills my cup. And so I love going out and working across the state and providing trainings in practical skills that I've been studying and that I enjoy talking to people about. And then I learn from them what they're struggling with and thinking about. And that further kind of hones and helps me think about research questions. We even wrote a blog about it. So the funder has a blog, and they knew that we were doing all these research briefs, and we said we'd be happy to talk about this in a different kind of venue. And they're like, what about writing a blog? So I co-authored a blog on being brief, which for those who know me, there's an irony there in that title, and how to really write research briefs. PBIS has been so baked into Maryland, and by the way, it's not just Maryland, 29,000 other American schools that are using PBIS and have been over the last 20 years and internationally. And it is actually in policy. So we've done some great policy work as well. I'm not going to talk in detail about it, but Catherine Bradshaw led a paper looking at a 2008 policy that I was a part of and contributed to, looking at the impacts of the mandate to implement PBIS when your truancy rates were too high on actual implementation and outcomes. And what we found was it turns out when you mandate things doesn't really mean everybody does it the way they're supposed to that next year. But over time, it actually did predict getting trained in PBIS and implementing it. It just took a lot longer than we would have thought. More recently, in 2009, there was another law passed about restorative approaches. And that went through many iterations and different hopes and dreams about what that would look like. But ultimately, it said to school districts that they had to have in their discipline policy something about restorative approaches, and one of which was PBIS. And so that is something that the state practitioners that I've known for a long time had been thinking about before that law, and then certainly were thinking about after that law. And I had a Spark Award from the Bloomberg American Health Initiative here at Hopkins, funded to do some work to examine what that really looks like in practice. And so I have this is actually a clip of a brief that I have made of the findings of the paper for practitioners. We're trying to publish that in the newsletter, the research journal for the American School Superintendents Association, because those are the people who need to understand about how to implement these policies. And we found that the themes that emerged from our key informants, who are district personnel across 5 different districts, there's only 24 in Maryland, that investments, supportive state and local policy, data and accountability, shifted mindsets and school culture, and alignment were the different themes that really emerged about how you actually do this work. And that aligns very well with literature and implementation science, which is always exciting when you're a researcher. And they actually identified really clear solutions that they think would help to promote better implementation of restorative approaches in schools. There are a lot of implementation challenges in real-world settings, and certainly in schools. I use this diagram when I actually teach classes about school-based prevention, try to organize the thinking of what are the different drivers and barriers or facilitators of implementation. It takes more than this, but these are the big ones, I would say, these 6. And I would say that implementation takes all of these things. It's really hard to get all of these things in place to implement with fidelity, but coaching is something that can promote so many of these things. So sometimes we have challenges with fidelity because people just don't have the skills that they need, or the self-confidence or self-efficacy to implement. Sometimes they do it because they've been asked to do so many things in schools, which they have, and they've watched so many things come and go that they're just gonna wait it out, and they know there's no accountability, so they know to wait. It takes so much time to learn. I mean, a new curriculum. Teachers are faced with so many things that they have to do in a day with so many little people. I mean, even when they're big people, they're little people, and it is an extraordinarily difficult job. I mean, I couldn't possibly value what teachers do anymore. And I understand that the time to really plan and implement and organize what we as a field of researchers have put out as these highly complex, highly efficacious programs, often not as simple always as this idea of like the good behavior game. But even those are challenging for teachers. And so coaching really helps build up their skills, build up their confidence, give that accountability, not in a bad way. Unfortunately, we have a lot of bad accountability in schools, but really just like that reminder. I hear this a lot with our coaching studies. It's like they see the coach and then they start to implement again and they say, oh, I didn't get to my goal yet, but now I see you, so I was doing it. And it's like, that's great. Fake it till you make it. Just give it a shot. Because oftentimes what happens is when teachers try something new, they put themselves out there, they see something working, they are going to be more inclined to do it again. That's true of all humans. And so coaching has been, for me, this lever for how we can think about improving ecologies for youth, thinking about adults rather than just the kids. I could talk for way over an hour about my coaching research. I love coaching research. I'm going to just give a really brief summary through this partnership lens again. 3 main topics that I focus on with coaching is really what are the core components of it. I've looked at things like the alliance between a teacher and a coach, and we found that that is an impetus for implementation. We've looked at communication skills. This is really nerdy, but I'll share it. There is a way to study exactly the occurrence of different types of language and seeing if they're more associated with one another. So I do a lot of work in motivational interviewing, and people that are doing motivational interviewing are supposed to be evoking and eliciting change talk, this idea that I want to do something different, and because when we say we want to do something different, we're more likely to do something different. And this has been studied in counseling and is being used in medicine, motivational interviewing. And what we found in schools is that it is true that when coaches use consistent language, they do see more change talk. It is also true that change and sustained talk go hand in hand. And that's this idea of ambivalence that I'm sure you've all had this, right? Like when we set your New Year's resolution, for example, and you know that you want to do something differently, but you kind of don't want to do that thing differently. Usually it's like a health goal. That's just totally normative. And that's what we teach people in motivational interviewing. It's normative. It's okay that people are going to be ambivalent. We expect that. And that's what the data show. Looking at the main effects, when we coach teachers, do we see changes in their practices, their attitudes, and student outcomes? And the answer to that is yes, and we're still trying to fill in the gaps about longer-term sustained impacts. Something that really matters a lot to practitioners is costs. Coaching has been around for decades in schools and lacked an evidence base when I came into this field. And it's been something I've been excited to fill some gaps on. But one of the challenges, and I have to own this myself too, is when I do coaching trials, is that we're putting an external person in. And that's not the same as people coaching in their roles in schools and carving out that time. And so one of the things that always comes to mind is the cost of that, both in time and then personnel. And so I've been a part of and led a series of different coaching cost studies. We've looked at coaching when we just coach one teacher, coaching with 2 teachers at the same time, and then coaching versus our traditional workshop-based professional development, which is kind of what we say, like say and pray. Like you say your stuff and you hope people are just going to go do it after the fact. And we know that's not effective for changing behavior. So one of the things that was missing in coaching for a really long time is this idea that we would coach people, they'd set goals, and then they just would implement in the classroom. That would be it. They would practice in real life with their 30 kids. And there wasn't a real opportunity for structured practice and feedback. And so a colleague at the Kennedy Krieger School came to Catherine and I long time ago and said, we have this access to this mixed reality simulator. It's called Teach Live. It was developed at the University of Central Florida. And you can put teachers into the simulator and they can interact with these kids who really interact like real life, and they can practice the skills. Would you want to partner on a study? And so at the Kennedy Krieger School, yes, please. And so we sought out funding through the Wendy Clagg Center. I got a small pilot a decade ago. And we started to work on that. And we found that it did, in fact, change teacher practices. But that idea came from the field. And that's where the partnerships are so important. I wouldn't have known about Teach Live if it wasn't for my colleague at Kennedy Krieger. And then from there, Catherine and my colleague Tracy Wasdorp at CHOP, who used to be at Hopkins with me as a postdoc, are experts in bullying. And bullying is a really important topic to schools. It's something we were tracking trends of together in Maryland leading up to this. And we knew that schools were prioritizing it and they didn't know what to do about it. And so we thought, what if we take this mixed reality simulator and some of the coaching work we've done and try to blend it and adapt it to be focused specifically on bullying? And that's what we did. And so we developed that together through a study funded by the National Institute of Justice. And we actually are in our last of 4 cohorts in an NICHD randomized trial in R01. So the other, I think I might have missed a slide, but the next segue was really around this idea, building this idea of like where ideas come from. So I mentioned this like PBIS Maryland relationship, and we've been doing a bunch of work looking at PBIS in schools, different randomized trials that we were working on. And a district partner came to us and said, we were working with middle schools at the time, and they were starting to roll out restorative practices, which was based on this idea of how we need to be able to teach people to repair harm when it's made relationally, and that should be a shift in how we think about discipline and teaching behavior. And they were doing this work with social emotional learning and with restorative practices to build community in schools in K through 8. And they said, we've got to get into high schools, but that's going to be a whole other thing. Would you want to partner on this? And so I said, okay, sure. So district identified the need. I went and worked with them to develop a grant, and we were funded at the absolute worst time you could ever be the PI in a school-based trial, July 2020. So we pivoted. We had to be online. The district said, look, everybody needs this. Kids are struggling. We have this student wellness block that we need structure for. I said, I think we could do this with all of the schools. Okay, let's do it. But I think we really should collect more data, and can't do focus groups because of, the whole district is doing this and we're all on Zoom. And they said, okay, well, we can take on putting out surveys, anonymous surveys. So what was supposed to be with 2 schools and focus groups became 5 surveys across a year during COVID, where we had at one point 9,700 students respond about what they thought about our curriculum. So that was a lot more than we expected. And it was all because of being able to partner, being able to have those open dialogues, and to make a change where we needed to make it. Through the life of that study, it's been 4 years since that was funded. We're at the tail end. We really did community-based participatory research in a way that I can say I'm really proud of from beginning to end. It was their idea. We developed together. We developed the content together. We had meetings to review content. They rolled it out and embedded it into their existing structures. And we've collaborated to think about how do we measure the outcomes, what are the outcomes we're interested in. And we've even recently had a publication where we were all authors together, the district folks and myself and my colleagues that are now at UVA, to what became called Well Connected. Well Connected didn't even have a name for the first 2 years because we thought, well, this is kind of the community's program, so we should survey people and get their input on this. And it took a while, and we had to kind of really marinate on it, but we finally came up with a name that I think is really a true testament to the work we're trying to do, which is it's student skills focused, it's promoting student wellness and their social emotional competencies and mindfulness. It's community focused around building community through regular coming together and doing community building circles, which is like a very structured process that's beyond the scope of what I can talk about today, and has those implementation supports for teachers to implement. Maybe the best data you could ever get is some of this qualitative data that comes in. And this is from a teacher in just the second year, said, this is great information. I wish I had it as a teenager. I'm glad I'm learning it now. Wellness doesn't stop when the bell rings. We want these kids in our communities to become adults and be good citizens. We want good people. It helps the community. I couldn't possibly have said it better. Just this summer, after 4 years of doing this work, an administrator said, students don't like words, they like videos, they like technology, they like those pieces. And that's some of the feedback we had given year 1 and was immediately changed. I appreciate the amount of work and effort that your team has done to get input from the people that are implementing lessons. I know that is a hard feat to have happen. So really feeling like they talked and we listened. We actually had a slide about that. Year 1, you talked, we listened, and we showed them what the data said about what they did not like about our program and what we were changing as a result. So that communication being so tantamount to that success. I don't know that all teachers would agree with this one, but one teacher actually said at the end of this year that about the lessons specifically, they're easy to tweak to your teaching personality and they're easy to tweak to the kids' personality. And this gets at that idea of feasibility and acceptability and just this fit because we know that when people are trying to do something that they don't feel fits with them, they're not going to do it. And so that was a really great quote to stumble upon. As I tell Holly Wilcox all the time, some of the most important work I've ever done is the work that she's brought me into in schools, which is around suicide prevention programming. I literally feel this way. It's genuine when I say it, but I said, what could be more important than saving people's lives, right? And so she has brought me in to do some work on suicide prevention. And we've worked now on 2 different programs in schools. The first was an adaptation of the Teen Mental Health First Aid Program, which teaches teens to identify their own crisis and those in others and get them help. And so we both helped to adapt it, and then we studied it. What I want to highlight here, though, is another example of partnership. So we tried to have a randomized trial to study the impacts of this, and practice happened. And there was drift, and they didn't quite do it the way they were supposed to. And we wound up saying, okay, we can still do this. We have methodologists for this. This is why we are here. So we pivoted, and we looked at it as a quasi-experiment. And that was the first work to look at teen mental health first aid in the US. The last thing I'm going to say about schools, I mentioned it already when I talked about the findings about students feeling helpless, is how key partnership is to public health surveillance and how essential schools are to surveillance. They already are identifying kids with disabilities through special education. They're already being asked to support these children. They're already doing all the surveys that we love in public health about what is happening with kids. And so the last thing I want to talk about is the Autism and Developmental Disabilities Monitoring, or ADAM network, which Chris Latacasa and I lead in Maryland. This has been in the Bloomberg School as a contributor from the very beginning in 2000 when they started to monitor autism. That was back when I was working with kids, and I said, we didn't even say autism yet. We talked about pervasive developmental disabilities. The age of identification at that point was somewhere between 6 and 8. And the CDC knew that there was this problem to tackle and developed this network to be able to track the prevalence. That has morphed and evolved and moved from what used to just be 8-year-old prevalence to 4-year-olds and looking at early identification. And the good news is we're winning in that. We're moving that needle, certainly in Maryland. And now we also look at adolescents. And that is such an important thing to think about as our adolescents and our children with autism are growing into adolescents, and our adolescents are going into adults, and how we support them. So this slide that I have here, Adam has baked in this idea of what they call E&O, education and outreach. These pictures are actually what are on the community reports. So we have an MMWR that comes out with this. You'll see it in the news. And then you have these community reports that summarize state-based data, which is really excellent and an amazing foundation. And also, there's more work to be done that we've been really trying to fill the gap on in Maryland. The 16-year-olds in particular are a newer group, and not all sites even look at 16-year-olds. And so they don't have the same kinds of community reports. So our team has really done a lot of work to think about how do we present this data to school systems that are partnering with us. They're giving us access to their records to be able to identify where these kids are. So are health sources. And that can be sensitive, and so we are trying to give back. So here's an example of a summary. It's de-identified, but we give county level data back that kind of signifies to them comorbidity, services that are being received, and it benchmarks them. And the thing we spent the most time thinking about is that back page, 2-page, 1-pager, about how they might use this data, because it's overwhelming and it's hard for them to wrap their heads around. So we have a column that's around key takeaways about what the findings are overall. We have questions they can ask themselves in a non-judgmental way. So we went back and forth. Do we tell them what their data are and the questions they should be asking? Or do we just present, what does this data mean? Here are some of the questions you should be asking. And here are some of the data points in your report that you should consider in asking those questions. We don't yet know about whether that's changed practices, but we are trying to fill those gaps. Another important thing is that we have these great reports about 16-year-olds, but there isn't that distillation. So our team also undertook summarizing 2 papers from 2018 into a research brief that presented key findings. And that's something we've shared with the entire network, but we've shared with all of our partners in Maryland. So that is a lot that I have shared, a lot of different ways that I've thought about partnership, and I hope what came through are those themes that I talked about, generating those questions and problems on the ground, building good partnerships and being a good partner, thinking about the importance of fidelity and the structures that we have to put in place to support implementation in schools, and thinking about measures that matter to real people. We've come a really long way in public mental health. We've come a really long way in schools. But when I reflect on those things that I started off with about protecting youth mental health, I see so much promise and so much energy in schools going into this great work. And I also see room to grow as a field and more research that needs to be done. So we increasingly see schools focus closely on issues related to the prevalence of mental health, that there are trying to work in forming meaningful partnerships. There's been, like in Maryland specifically, we've had great amounts of money infused into the idea of schools partnering with mental health providers and other community agencies to support this work. We also see pendulums swinging away. There was an immense amount of money infused during COVID to schools that just ended this year, and that creates a real new reality for schools as they think about this work. We also see macro systems that are working against schools' abilities to truly provide a positive and affirming school environment for our kids. And that's something we all have to take very seriously. There's so much work left to do in translating evidence back to educators. The great news is when I started in this field, we didn't even know what worked. Now we have lots of ideas about what works, but we have to really grapple with how do we get it put into real places. And some of that might be thinking differently about what we know works and developing different things, filling gaps. One of the things that came through in the work that I've done with Team Mental Health First Aid, with YAM, with Well Connected, students have mental health at the top of their minds and they want more. They want it earlier, they want it explicitly taught, and we aren't really there as a society. So there's definitely work to be done there. We really need to listen to our kids. And we've done much better with equipping educators and youth to recognize the signs of mental distress and crisis, but there are still barriers in having that achieved. There are access issues, there are shortages. I didn't talk today, but I have an immense interest in workforce mental health. I've done a lot of work on teacher burnout and self-efficacy and stress. And so I've been thinking for a long time about how we could do more systemic research on how to shift the organizations to really support workforce mental health, to promote student mental health. So just my final thoughts here. As the trends in youth mental health change, so too must we. I came in as a very quantitative-oriented person. I came for even more amazing quantitative training as a postdoctoral fellow. And I am trying to find the partners, I have them luckily, that know more about mixed methods and qualitative research. And I have found that to be essential to true partnership and to really meeting the demands that we're up against. Partnerships are essential to the goals of public health. I know I don't have to say that in the school. We hear about it all the time, and it is increasingly uplifted and recognized. But we have to invest in those partnerships. And there are just realities of our incentive structures that sometimes go in the face of good, true partnership. Because partnership is showing up, and not because there's a paper to come out of it. It's just being there. It's extra work, and it doesn't always count. And so I think we have to really continue. I know in the school we've done a lot of thinking about that, and I think we have to continue to do that. And one thing that this is kind of a big one, but I really grapple with this idea of how we balance creating something that's scalable and sustainable to protect and save millions of lives at a time, but also is responsive to community needs. So much of what I hear from schools is like, well, our community is different. They want things that are adaptable and tailorable, and we are not quite there. We haven't struck that right balance yet. I know at my own work, I'm working through that, and I know the field is too. So I'm just gonna wrap up and say it takes more than a village. It takes very, very many villages. There are so many faces, I can't even get on the 2 slides I have dedicated to the faces, but these are the faces of the people that have contributed to the work that I've directly cited here. I couldn't even find all of them on the internet, so not everybody's there, but there are so many villages that have allowed me to thrive and partner and do this meaningful work that fills my cup and is hopefully impacting the children the way I hope. So thank you for your time and your attention. I know this is such a hard day to be here. So thank you for being here. It really means so much to me.
Elise, that was just absolutely fantastic. Such a good job of telling the story of your career and how what you've learned and how you've grown throughout your career, and it's just phenomenal. So congratulations on all the great work, and I'm sure there's a lot more to come. We have a few minutes for questions, and if you're online, if you'd like to ask a question, you can just put it in the chat, and we can call on you. Just raise your hand. No, don't raise your hand, right? Just put it in the chat, right? Because we can't see everybody on the screen here. But first, let me turn to our audience here in person. Questions, comments? Yes. And let me, would like you to,
Thank you for this amazing talk. It's good to know there's other people like in the same space that I'm in. Like in terms of your work and like an ecology of health, where do you see school policing and other school policies that influence like a lot like communities of color, like in terms of histories of social control, like racism?
Yeah, I mean, I think it is a daunting reality of where we are as a society with violence and concerns that bring police officers into schools. And I also know that there are far more investments going towards that than maybe towards our mental health providers in schools. And so, that is definitely quite the question. There is a space in which school resource officers can be a resource and can be an adult that cares. I actually did see it. I worked in a high school before I came to Hopkins where we did have a school resource officer, and he was wonderful with the kids, and he had a great relationship, and he was doing the kinds of things that could be protective. And also, inevitably, there are harms that can also be done. I would just say in general, what we always say in PBIS is when a kid can't do math, we teach. When a kid can't read, we teach. When a child doesn't know how to behave, we punish. And so that is a testament to the way that we think about behavior and the way that we think about our role as adults. And so I would always err on the side that we should be teaching, we should be supporting, we should be nurturing. I am not a person who's in charge of these decisions, and I can't possibly know what it's like to run a school, for example, that's had a school shooting and say undeniably that you should never have a police officer in a school, right? So I think that there's always space to grow, and I think we should be investing in nurturing and supporting and strengthening and building up.
Other questions? You're getting a lot of accolades in the chat, which
Well,
we'll
thank you.
save for you so that you can see
Awesome.
those.
Thank you.
I guess maybe I'll take the prerogative of asking a question. Are there policies that can change or policies in place to be able to especially translate all that good research that's been accumulating over decades into practice at the schools?
I think policy is definitely a piece of the puzzle. I don't think that a policy can make the types of change to get it put in place. Policies without structure, accountability, supports, and funding don't go very far in education.
Sure.
We have a lot of unfunded policies in education and underfunded. We've never funded special education law the way we dreamt that we would in 1975. So, but it is definitely, and that came through with the administrators that we spoke to about the policy in Maryland. What they said is that's exactly what we need. We do need the state to say, you need to shift the way that you think about discipline and be more restorative. And they did need that local support from their superintendent, but it's not enough. Yeah. So yes, policies can absolutely shift and make change, but they have to come with the support systems and the funding and the infrastructure to really engage in that work.
Sure. Yes. Let me get to the microphone here. Oh, I'm sorry. We'll let Phil go and then you can go.
Hi, Phil.
Great presentation. You just want to highlight a couple of things you mentioned, that there was $1.5 billion new dollars going in just in Maryland for the education system last year and targeted for also an additional increase this year, of which $120 million was for external mental health services. We also have a relatively new superintendent of schools. What do you see as some of the specific opportunities that the school and the departments might be able to participate, given that in the past it was very difficult to get funds with lots of good ideas? Now there's actually money coming in, but as you were saying, it's not necessarily braided together in the most effective way. Are there some specific hopes or ideas you have that really could help us facilitate Hopkins connecting with the resources that actually are out there?
Yeah, that's a great question. So yes, you're right. There's been a great infusion of funds in Maryland specifically. That's an example of a policy that actually came along with funding to get the policy implemented in the blueprint for Maryland. And so I think the piece about partnership, I mean, one of the things that's really hard about partnership is that there's a human part of that and people change. And so as you talked about, there's a new superintendent, there's a lot of different new people in agencies. And I think it just is about coming together to build those partnerships, those relationships, finding shared visions and incentives, and really that braiding. I mean, I've learned that from you, Phil, is that there is a lot of money out there, but we aren't always optimizing the way that the money flows because sectors are kind of concerned with their specific outcome, their specific stream of resources, or resources kind of come and go. And so I think there is great opportunity in our state specifically around building that infrastructure, having the translation piece built in partnerships with higher education, with the community agencies, and then actually in the government too. I mean, when we think about autism, for example, that lives in multiple agencies, the Department of Health, and then in the State Department of Education, and then there are all these different initiatives that kind of are in some siloed part of an agency, or they kind of go across agencies. It's really hard to navigate. It's hard for real people to navigate. It's hard for families and parents of kids to navigate. And so I think really just trying to get rid of some of our silos, break down those walls, open the communication, and thinking about more braided initiatives where we can all get to the same place that we're trying to go. I hope that answers your question. Okay, in the front.
Yeah, go ahead.
Yeah, I'm curious how you see the role of social media in your work. I've worked as a teacher and I've seen it increase anxiety and depression in a lot of students and even violence. But I've also seen it as a really powerful tool to kind of meet students where they're at and disseminate mental health resources. So
we not jokingly talk about, Holly and I have talked about this, like we just got to get on TikTok and start getting out the mental health strategies, right? So there is a really amazing amount of leverage that social media can give us in promoting public mental health. If you're going to ask me what I think about social media and cell phone use in schools, I would say absolutely it doesn't belong there. It is a distraction. The goal of being there is to engage and learn. And we all know it. I do it all the time. We zone out. We get onto our phone and we're multitasking, but we're not multitasking, and neither are the kids. And so I'm going to answer this kind of diplomatically, like I did the one with the police. I don't think it's an and or. It's like, I mean, or like a this or that. It's kind of like an and or. Like, I think there are children out there and adolescents out there that beyond being a resource for things like how they help cope or mental health, it gives them a community that they don't have in their immediate physical proximity. You can't take that away. But when you think about in schools, when kids are spending all this time on their screens and their phones instead of attuning to what the school is trying to do, it's a major barrier. And it creates an immense power struggle for the adults. For teachers and for students, there just has to be consistency. It has to come from the top. The teachers need that support. So I do have a very firm stance on that.
thank you.
So we're very pleased that Danny Fallon is online with us, and Danny has a question. So do you want to unmute yourself, Danny, and ask the question?
Sure. Congratulations, Elise. It was just amazing. So my question is, you showed us, you got, traditional NIH support, which public health researchers often get, but you also had IAS support, CDC support, DOJ support, foundation support, like the Bloomberg philanthropies. Do you have advice for others who want to follow this path and kind of diversify their funding sources, realizing that the goals, the formats, all that is different across those different funding agencies?
Yeah. partnerships, have friends that do things in other areas, right? I mean, it is daunting. It is easy to stay in your lane because of how hard it is to just get over the hump of how to apply for a grant, right? Because there's so many different requirements. And I think it's just about getting outside of your comfort zone, but leaning on colleagues, working together. You definitely know this, Danny, about me, is I always say there's no me in team. I am a team scientist through and through, and I MPI most of the work that I do. And the reason for that is because I know that there is no one human being, at least I'm not that human being, maybe others are, that can really just do it all. And part of it is just that diversification. So, for example, the NICHD funding that I partner with Tracy Wasdorp on, she was more familiar with NIH funding than I was. And we took this on together, and we supported each other, and we were kind of each other's yin and yang and getting that grant written and getting it out the door. So to me, it's really just about working with others and learning from others and having the humility to ask for help.
Well, I think that's a great note to end on. Partnerships are clearly important, and I think they're going to be more important than ever as we move forward. So again, I want to thank everybody for being here. Thank you, Elise, for an incredible lecture and for all you're doing. And I'd like to invite everybody, those of you in the room, unfortunately, those of you online can't partake of the reception, but I'd like to invite all of you here to the Wall of Wonder, where we can continue the conversation. And again, thank you all for coming. And as Elise said, this is a difficult time for many, if not most of us. And so we do appreciate your being here and engaging in these conversations, which are just incredibly important. So thank you for coming, and thank you, Elise.
Thank you so much.